this video, we're going to demonstrate the technique used to take a pulse and respirations. Before starting any procedure, I need to introduce myself, check patient's details and gain consent for the procedure. So, hi, my name is Lucy, I'm one of the nurse practitioners here. Can I just check your name, date of birth and address, please?
Yep, my name is Daniel White, my date of birth is 20th/6/76 and my address is 2 Hill Close in St Austell.
Wonderful, thanks very much. Dan, I'm here today to take your pulse and respiratory rate, if that's okay. Just
sure.
means me feeling your wrist here for your pulse, so I just need you to be nice and relaxed as much as you can be, if that's okay.
Sure.
Excellent. So I'm just going to raise your pulse here. Just making sure your arm's nice and relaxed. I'm going to count this for 1 minute now. So I'm just counting the radial pulse, but you can see that I'm using my index finger and middle finger. I'm a couple of centimetres up into the wrist, just from the base of the thumb here. And you should be able to press down lightly and you should be able to feel the radial pulse. If you're not able to, press slightly more firmly. This should be fairly easy to feel. We're checking this pulse for a full 60 seconds. This is the best practice so that you can look at other characteristics for the pulse. So if it's regular or irregular, there's lots of other characteristics depending on which of your clinical areas you work in. You might be required to know different characteristics. This will give you the opportunity to feel that pulse for 4 minutes. So I've just moved my finger slightly. I've taken Dan's pulse for 4 minutes. I've just moved my finger slightly and I'm just now looking at his breathing. I can see quite clearly his chest rising and falling with each breath. So each inhalation and exhalation is 1 breath, and I'm counting like those for another full 60 seconds. So in this time, I'm also just taking note of Dan's general appearance. He looks relaxed, he doesn't look in any pain at all. His breathing isn't laboured. Also just looking at general colour, there's no blueness around the lips, which would indicate a cyanosis. He's not using any accessory muscles, so any muscles in the neck or abdomen, which would show an increased work of breathing. That's very comfortable there. I've not told him that I'm now counting his respiratory rate, because by alerting the patient to that, they can sometimes alter their breathing patterns subconsciously, and that may affect your respiratory rate. That's great, thanks Dan. I did your pulse there, so that was 60 beats per minute, nice and regular, and your respiratory rate was 12 breaths per minute. Again, both within normal parameters. That's great. Thank you ever so much for that.